Everyone, bonjour à toutes et à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie de COVID-19. My name is Kina Leclerc and I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de cette séance. As usual, please keep your microphone on mute until I invite you to ask your question. Comme d'habitude, s'il vous plaît, désactivez votre microphone jusqu'à temps que je vous invite à poser votre question. Today, we'll be hearing from remarks from Mr. Mayor, the Mayor Jim Watson, followed by Councillor Jenna Sudds, Chair of Community and Social and Protective Services Committee, la conseillère Jenna Sudds, présidente du Comité des services communautaires et de protection, Councillor Keith Egli, Chair, Ottawa Board of Health, le conseiller Keith Egli, président du Conseil de santé d'Ottawa, and Dr. Vera Etches, Chief Medical Officer of Health, médecin-chef en santé publique. Available for questions from the media following the statements. We have disponible pour répondre aux questions des médias, nous accueillons aussi Dr. Brent Millockney, Associate Medical Officer of Health, médecin adjoint en santé publique, Donna Gray, General Manager, Community and Social Services Department, Directrice générale des services sociaux et communautaires, Dan Chenier, General Manager, Recreation, Cultural and Facility Services, Directeur général des loisirs, de la culture et des installations, Roger Chapman, Director, Bylaw and Regulatory Services, Directeur des services des règlements municipaux, and Clara Fieri, Lead Human Needs Task Force, responsable du groupe de travail sur les besoins humains. After we hear from the panelists, we will take questions from the media. We will now begin with remarks by Mayor Jim Watson. Merci.
Great, thank you very much. Good afternoon, everyone. Bon après-midi, mesdames et messieurs. Well, it's not really gardening weather today, but with the snow we had earlier, it was nice to attend the opening of the Knox Church Community Garden this morning with Councillor Keith Egli and Mo Guerin, Executive Director of Just Foods Ottawa. Thanks to Allison, the Community Gardener Coordinator for Knox Community Garden Church, and all of our community gardeners for your hard work. We have over 100 community gardens. I'm very pleased to see that they're now going to be open as long as people respect the rules and regulations that have been established by Ottawa Public Health. And we thank Just Foods and all of their great work that they're doing to get the gardens ready for planting and hopefully in the next couple of weeks and months harvesting. On Wednesday, I announced that individuals and families are now able to enjoy fresh air and various activities in city parks and beaches. We've received very positive feedback about this decision, and I've heard from many residents that this will make a difference for them as we continue to practice physical distancing. It's been great to see residents enjoying the parks again, children running in the parks, kicking around the soccer ball, tossing a frisbee, doing yoga, of course, all in a safe way. Il s'agit là d'un petit pas, mais un pas important, vers un retour à la normale. I want to remind everyone that it's important that they comply with the current prohibitions under the provincial emergency orders. This includes the prohibition on organized public events, gatherings of more than 5 people, and entry to and use of certain outdoor recreational amenities, such as play structures, benches, picnic tables, and enclosed dog parks. Residents are also reminded that entry into or use of all sports fields and courts, like tennis courts, ball diamonds, football and soccer fields, skateboard parks, are prohibited. We need to remember that COVID-19 is still in our community, and we must remain cautious while being mindful and respectful of the health and safety of everyone in our city. After my announcement, I had a number of inquiries from residents on Twitter about how they can use city parks, and that is why today I'm pleased to announce a new initiative for our parks. Starting Monday, May 11th, just in a few days, we will be launching a Park Ambassadors program. Park ambassadors are trained city staff who can provide guidance for residents who are using some of Ottawa's busiest parks. They can provide information, answer questions, and clarify any confusion about what's permitted in city parks while maintaining a safe 2-meter distance from others. They can be found working in pairs, wearing green t-shirts that residents already identify with the city's recreation and culture programs. On chilly days like today, they will wear red jackets with markings that identify them as city staff. I want to make it clear that these park ambassadors are not giving out tickets. The park ambassadors are already existing city parks and recreation employees, so there will be no added cost to introduce this program. Je tiens à vous assurer que les ambassadeurs de parcs ne donneront pas des contraventions. Their role is to educate and inform park users about how to use the parks, how to get more information about recreation, social, and mental health resources in Ottawa. City staff have identified a list of the city's busiest parks and will review this on an ongoing basis. And park ambassadors will follow Ottawa public health guidelines for safe use of parks. Les ambassadeurs des parcs suivront les directives de santé publique d'Ottawa pour que les parcs soient utilisés en toute sécurité. I'd like to offer my congratulations to Councillor Meehan for originally raising this idea at an earlier council meeting. In addition to the park openings announced on Wednesday, the parking restrictions and barriers will be lifted today at Mooney's Bay, Britannia Beach, and Petrie Island. Staff will continue to monitor the usage of these parking lots and will re-implement the parking restrictions if residents are not respecting physical distancing practices. Today, I want to also provide you with an update about the Social Services Relief Fund. This morning, we learned that nearly 2 million people across Canada lost their jobs. While Ottawa remains relatively sheltered from this significant job loss, Stats Canada reported that we were the third least impacted region in the country. We still experience job loss in many sectors of the city. This month and the months ahead, many residents will be in need of social services support as a result of losing a job. On April 20th, we announced that $3 million will be allocated to support nonprofit and charitable social service agencies experiencing persistent and immediate needs due to the COVID-19 pandemic. This funding is a result of support we have received from the province's Community Homelessness Prevention Initiative and the federal government's Reaching Home program. We invited local organizations and agencies to apply for funding between April 20th and 27th of this year. I'm pleased to tell you that 73 agencies have been selected to receive funding from the Social Services Relief Fund. Chair Suds will go into more details about this funding in a few moments, but I wanted to thank all of the organizations and agencies that applied. We look forward to seeing the positive results of the good work that will result from this funding in our community. I'd also like to remind everyone and let everyone know that we will be hosting a second virtual town hall meeting next Thursday, May 14th at 3 p.m. I'll be joined by Councillor Eglai, Steve Kanalakis, Dr. Etches, Anthony DeMonte, and Chief Slowly. I've done my very best to connect with residents online, but with all the new information being shared every day, I look forward to hearing questions and comments from residents about their issues related to COVID-19. Details will be in advertisements in Le Droit and the Ottawa Citizen tomorrow, and we look forward to providing more information through social media in the days ahead with that upcoming virtual town hall meeting. Thank you, merci beaucoup, and a happy Mother's Day to all the mothers in Ottawa who are celebrating this very special day. Thank you, merci.
Thank you, Mr. Mayor. We will now hear from Chair Suds.
Thank you. Good afternoon, everyone. Bon après-midi tout le monde. I want to start by expressing my thanks to all of our healthcare workers and frontline workers who continue to put their health and safety at risk for our community. Je remercie aussi chaleureusement tous les travailleurs de la santé et travailleurs de première ligne qui continuent de risquer leur santé et leur sécurité afin d'aider notre communauté. Today, I want to expand on the Social Services Relief Fund that Mayor Watson was just speaking about. The city's Human Needs Task Force allocated $3 million to help nonprofit and charitable organizations provide social services to address immediate and ongoing needs due to COVID-19. The Social Services Relief Fund was funded by the provincial and federal governments, and I'd like to thank our partners for helping to support our city's most vulnerable residents. As Mayor Watson mentioned, we received 119 applications for the funding with a total ask of just over $14 million. Clearly, the need outweighs the funding that we have available. De toute évidence, les besoins l'important sur les fonds disponibles. We prioritize the proposals on a number of factors, including applying an equity lens with attention to at-risk population groups, food security, basic needs, the ability to deliver the highest impact for the amount received, geographic distribution across the city, services provided in congregate living settings, efficiency and coordination across service sectors, and whether the agency had received other funding from the United Way, Ottawa Community Foundation, federal and provincial governments, and municipal renewable community funding. Of the 73 agencies that will be receiving funding, 40 of these agencies are homelessness service providers and residential service homes. The remaining 33 are community agencies that provide essential services and supports for at-risk residents and equity-seeking communities. Successful applicants will be notified by email today. Nous enverrons aujourd'hui un courriel aux organismes qui recevront un financement. A few examples of what this funding will be put towards include Indigenous community needs, isolated seniors, mental health responses, food security, day programs, community houses, community hubs, residential service homes, supportive housing, and emergency shelters. It's also important to note that requests for funding for personal protective equipment were among agencies' most pressing needs. Il importe aussi de noter que les demandes de financement pour les équipements de protection individuelle figuraient parmi les besoins les plus importants des organismes. This is critical because community agencies require a constant and reliable source of PPE in order to support and protect the health of frontline social service staff, who are doing a wonderful job of providing essential supports to residents in need. We also have good news on that front. J'ai des bonnes nouvelles au sujet aussi. The city's Human Needs Task Force will be funding $1 million worth of PPE supplies to community organizations that applied for the Social Services Relief Fund. I want to thank the task force for identifying a way to fund this need outside of the $3 million funding envelope, as we will still be able to fund other immediate needs while also providing the critical PPE for social services staff. The city will reassess community needs over the coming months, and the Human Needs Task Force will continue to work closely with community agencies to address the needs of our most at-risk residents. I also wanted to extend my thanks to TELUS, who generously donated 100 tablets with a year of data to agencies in need. I think this is a wonderful example of our community coming together to help our most vulnerable residents during these difficult times. So thank you. Merci beaucoup.
Thank you very much, Chair Suds. We will now hear from Chair Eglai.
Thank you very much. Hello, bonjour, Quay. This morning I had the pleasure to attend the opening of a community garden in my ward, as the mayor indicated. To see the work that Ottawa Public Health and Just Food has done to promote these resources really put a positive step in my day. The information, the guidelines, and the safe uses are available through Just Food and Ottawa Public Health. And the gardens are an excellent community resource for local and sustainable produce, in addition to providing opportunities for fresh air and physical activity. I think I echo many when I say that I am proud of how together we are taking responsible steps to accommodate the needs of others while ensuring the overall safety of our community. It is a difficult balance to maintain, but we adjust and we adapt. We are progressing. Park restrictions have loosened, community gardens are opening, and additional businesses will shortly begin operating. Although we are all pleased to see the easing of the restrictions, we are not out of the woods yet. This needs to be done carefully while maintaining public health principles or I understand that we risk resurgence. It remains crucial that we continue our excellent work. If restrictions are lifted too quickly, we risk a worse outcome than before. I truly believe that the more diligent we are at following the guidelines set out by the province and Ottawa Public Health, the quicker we will get through this pandemic and the safer everyone will be. This is why we are working together, all three levels of government, to ensure public health and economic considerations are in step. And we still need your help. I spoke the other day about masks. I was happy to wear mine today at the opening of the community gardens, as did Mayor Watson, and frankly, everybody was there, including the reporters. When physical distancing is difficult to maintain, I encourage you to wear your own non-medical mask or face covering. It is important to note that the masks are not a substitute for physical distancing or hand washing, but it can protect those around you. I've spent some time learning about the use, disposal, maintenance, and other key information on masks on the Ottawa Public Health website, and I invite you to do the same. If you are looking for non-medical masks, please visit this site as well for a list of resources, including where you can purchase one. So again, thank you, Ottawa. Together we can defeat this. And again, as indicated, happy Mother's Day to all of you out there. Thank you very much.
Thank you very much, Chair Egli. We will now be hearing from Dr. Etches.
Bonjour. So today I'd like to take a moment to recognize the healthcare worker who died as a result of COVID-19 while working to protect the health of others. And the family, friends, and colleagues of the worker are in our thoughts. It's very difficult to lose a member of the healthcare community, and we are really feeling devastated by this on top of the deaths of the residents. So Ottawa Public Health continues to be concerned for our residents in long-term care homes during this pandemic. And I want the population, especially those with loved ones in long-term care homes, to know that most long-term care homes in Ottawa are free of infection and have not had the level of deaths that we're seeing that are really found in 4 homes with the most challenges. So we know that homes in those most difficult situations now have in place support from hospitals. They have support with staffing, and this has improved the situation in the homes. We continue to see the deaths, which are resulting from infections that have occurred in the past. So we'll turn then to note that this week has marked the start of easing some restrictions in Ottawa, and the others have commented on the opening of parks and businesses. And although these public spaces are more available, the community is vulnerable to a resurgence of disease. Most people are not immune to the COVID-19 virus, and so there's a lot of us susceptible to infection if we come into contact with the virus. Bien que plus d'espace public soit disponible, la communauté reste extrêmement vulnérable à une résurgence de la maladie. La plupart des gens ne sont pas immunisés contre la COVID-19 et la grande majorité de la population reste sensible. So we do need to continue to practice physical distancing as some measures are being relaxed. That doesn't change. And I am encouraged that the motivation of the people of Ottawa to protect others around them will not change as well. So we are in a fortunate position to be able to observe what other countries are doing and to monitor the situation there to inform us as we reopen businesses and outdoor spaces. We are in a time when people need to and they want to return to activities that they love. And we recognize the burden that COVID-19 has created, the impacts directly on the health of residents and indirectly, causing stress and anxiety, the loss of employment, food insecurity, exposure to violence, even delayed access to medical and dental services. All of these have big influences on the health and well-being of our community. So Ottawa Public Health is working with provincial and municipal levels of government to make sure that as we relax restrictions, we're also minimizing the risk of transmission of COVID-19. We know that we have avoided the catastrophe of an overburdened healthcare system, and that is thanks to all of the people in Ottawa. We need to continue to keep this virus pinned down and at a manageable level. And I would like to continue to see a decrease in the hospitalizations that show we're reaching lower levels of infection in the community. Si nous recommençons trop tôt à interagir davantage avec les autres, le nombre de cas augmentera, risque ainsi de surcharger notre système de santé, ce que nous sommes parvenus à éviter jusqu'à maintenant grâce à vos actions. So, nous devons continuer à limiter la propagation du virus à un niveau maîtrisable dans la communauté. Et j'aimerais également observer une diminution du nombre des hospitalisations dans la communauté. Il importe de savoir, ce sont les actions de chacun de nous qui détermineront notre avenir. So what is important, it is the actions of each of us that will determine our future. And what you have done so far, what we have all done today, will continue to be important around physical distancing. People have done a good job at protecting themselves and others. So keeping that 2 meters between ourselves is what will continue to protect us. Durant cette période, le port de masque est important lorsqu'il est impossible de maintenir une distance de 2 mètres avec les autres afin de réduire la transmission du virus par les personnes asymptomatiques qui ne savent pas qu'elles sont malades. So during this period, wearing of cloth masks is an additional action that we can take to protect our people around us when we may be within 2 meters and we don't know if we have an asymptomatic infection. So as well, we will continue to promote testing of people with COVID-19-like symptoms, and we'll be continuing to do testing to control and detect outbreaks within either workplaces, community, or congregate care settings. So Ottawa Public Health will continue to work with our healthcare sector partners to make sure that we maximize our testing capacity. Please continue to visit our website, ottawapublichealth.ca coronavirus, for all the updated content about where to find a mask, how to open a business safely. Il y a beaucoup d'informations sur santépubliqueottawa.ca. Merci beaucoup.
Thank you very much, Dr. Etches. We will now be going to questions from the media. I will be going in reverse order today. You may ask one question with a follow-up. Nous allons maintenant répondre aux questions des médias. Je vais aller en ordre de Z à A aujourd'hui. Vous pouvez poser une question et une question de suivi. Again, a reminder to remain on mute until I invite you to ask your question. So we will begin with Pat Igoccioni at Your Community Voice.
My first question is for the Mayor. Mayor Watson, the unemployment numbers that came out today showed Ottawa as the least affected region in Canada. Just wanted your comments, or do you think this will be able to ride this out better than most cities? And is it because of our public sector and our high tech sector that we haven't seen the double digit numbers elsewhere in Canada?
Thank you for the question. I think if you look back before the pandemic ended up on our front doorstep, the economy was doing very well in Ottawa. Our unemployment rate was 4.2, 4.3%, one of the lowest it really had been in 30 years in Ottawa. So we entered this pandemic in a relatively strong position. And I think the fact that obviously the vast majority of public servants, which is our largest employment group, still continue to work has helped with that unemployment number, along with the tech sector, which is much more nimble than a lot of other traditional industries. You see, for instance, Shopify sent almost all of its workforce home to work from home, but they're still working, which is a good thing. So I think those two factors are to be credited why we have, I believe it was the third best employment record in the country. That's still too high when it's, I think, about 6.8 3%. We'd like to see it well below 5% and into the 4s. But, as I said, we're doing relatively well, but it's not a time to stop and bloat. We just had our economic task force meeting just an hour ago via conference call, and I was joined by my colleagues, Eli El-Shantiri and Laura Dudas. And we're still working very, very hard to ensure that those businesses that are open now have a fighting chance to remain open. And as we see curbside opportunities for other retail businesses, we'll start to slowly see more people coming back to work. But this is going to be a long-term project for the entire community. And we very much are driven by our desire to get as many people back to work as soon as possible, as safely as possible, following the health board's regulations and advice.
And just quickly, when can we expect some more updated numbers from your finance people? There is a council meeting next week. Could we expect some updated numbers then?
Yeah, our treasurer will be giving us an update on the city's finances at the council meeting on Wednesday.
Thank you.
Thank you very much. We will now be going to Gilles Taillon, Radio-Canada.
Oui, bonjour. Moi, j'ai deux questions pour le Dr. Etches. La première, c'est au sujet, bien sûr, du travailleur de la santé au Centre Madonna qui est décédé hier. Il y a quelques jours à peine, les médias ont rapporté qu'une infirmière contractuelle avait été renvoyée parce qu'elle critiquait les procédures de protection du personnel et des résidents. Dans quelle mesure ça peut avoir joué ou dans quelle mesure il faudrait renforcer ça ou qu'est-ce que vous en pensez, Dr. Etches?
Merci pour la question. Je pense que je peux répondre au point clé, mais si je manque quelque chose, laissez-moi savoir.
D'accord.
C'est concernant le travailleur à Madonna Care Community et les mesures en place pour la protection des travailleurs. Et pour nous, c'est quelque chose qui est un point de discussion chaque jour avec tous les organismes qui soutiennent Madonna Care Community. Nous avons une réunion chaque jour avec Sienna et le gestionnaire avec Gio, qui est aussi vraiment important leader avec le soutien pour Madonna Care Community et notre équipe. Et c'est de discuter le plan pour le contrôle de l'éclosion. Et le plan inclut l'utilisation des masques, les gants, les matériaux comme ça, mais aussi comment on traite les différents patients, s'ils sont positifs ou négatifs ou indéterminés. Nous utilisons la méthode on dit cohorting, on met les gens avec le même statut en une cohorte dans un groupe. Alors ça c'est mieux pour contrôler la transmission des infections. Et aussi, le point vraiment important aussi, c'est d'avoir assez nombre des employés qui peuvent donner le soin aux résidents. Et ça, c'est où Gio et aussi The Royal aider. On a ajouté beaucoup de gens pour aider les maisons.
Vous avez dit tantôt qu'il y a la majorité des centres, des foyers de soins de longue durée, il n'y a pas d'éclosion dans la majorité des centres de soins de longue durée à Ottawa. Mais les mesures que vous venez de décrire, puisqu'on parle de Madonna, elles sont déjà en place. Et il y a beaucoup d'infections chez les résidents et puis maintenant chez un décès chez les travailleurs. Est-ce qu'on peut dire que ça ne fonctionne pas du tout ou partiellement ou qu'il y a des améliorations ou il faut changer l'approche?
Pour les situations où il y a une éclosion, on voudrait voir que le nombre de cas arrête, l'augmentation dans les cas arrête. Sinon, c'est un signe que les mesures ne sont pas suffisantes. Mais c'est difficile parce que les mesures qui ont mis en place dans un jour prennent 2 semaines, 1 ou 2 semaines de voir les résultats. Alors, j'espère que la situation va être mieux dans 1 ou 2 semaines. Parce qu'il y a beaucoup plus de soutien dans les maisons maintenant.
Merci beaucoup.
Merci beaucoup. Moving on, we will go to Joanne Luscious at Ottawa Sun.
Hello, Dr. Etches. I might be asking you to repeat some of the same things in English, but I was wondering if you can tell me, you mentioned 4 long-term care homes that were particularly affected by outbreaks. Can you tell us which they are and how many deaths there have been in each of them and what the hospitals are doing to help out in this situation?
I'm sure. I'm just looking to see. This information is available on our website. So I would suggest for the latest information that you do look at the website for the specific numbers of deaths or cases. But the 4 homes most affected are Carling View, Laurier, Madonna, and Montfort, long-term care homes. And so the question is, how are the hospitals supporting? The hospitals are supporting in a number of ways. Usually it begins with an assessment of exactly what is needed in the home, because each home is different, and then it's a collaborative affair. So this is an effort of the Champlain Health Region Incident Command to stand up COVID response teams, which include the hospital leadership, public health, and we work with the homes. The assessment of what the home needs will guide what supports are provided, but what we are seeing typically is homes need assistance with staffing, whether that is personal support workers or cleaning staff or other kinds of supports. Those are being provided through hospital staff for the most part, although the homes are also being asked to pursue other methods to find and secure more staff. The support around infection prevention and control is also very important. So helping people understand exactly how to use some of the materials that can help prevent transmission, some of the practices like cohorting, making sure that everyone understands and has those in place.
Okay, and a follow-up question. Some of the situations in some of these outbreaks seem pretty dire. Are you able to tell us what your feelings are about what's going to be happening in the next few days in those institutions?
What I don't think anything's different from what's been happening for the last number of weeks, in that it's a top priority to make sure people get the care they need and that the measures in place are what's needed to stop transmission of the virus. So it just continues to be a focus of the COVID response teams, of the staff that have been added, and of the homes to work together to make sure that the situation improves into the future. I guess what I would say, you asked about what could we expect in the coming days. Unfortunately, I do think that the number of deaths can continue to rise because these are infections that have started previously, and we're seeing those that negative outcome now. But again, I hope that within a week or 2, we'll see the benefit of the added supports.
Thank you very much. We will now be going to Taylor Blewett at Ottawa Citizen.
Hi. So my first question is bylaw specific. With the Tulip Festival starting, I'm wondering, people who, obviously this isn't allowed, it's something that people have been asked not to do, but I'm sure people will be tempted. Those who stop and take photos of the tulips along Dow's Lake, what kind of fines are they facing, or other I guess measures are they facing if you do see people partaking in that kind of activity?
Yeah, can I just offer a comment, and then maybe Roger Chapman can offer more of a technical reply. As you know, Commissioners Park, which is beside Dow's Lake, where the bulk of the tulip beds are taking place, falls under the jurisdiction of the National Capital Commission, the NCC. So we wouldn't be patrolling that from a bylaw point of view. There'll be some parking restrictions because we don't want people to come en masse to see the tulips, for the simple reason that there are no amenities such as washrooms and so on. I happen to disagree with the idea that you shouldn't be allowed to take a picture. I think the whole purpose of going and seeing the tulips is not only to see the beauty in person, but also snap a quick picture. And my hope is the NCC reconsiders that regulation. It seems a little strong not to allow someone with a camera to take a picture. I understand if someone's sitting down there trying to capture the best tulip picture ever, and they're fiddling with their lens and so on. I think that is not permitted. But if you're just walking by, and there's going to be, as I understand it, people there to help you, to keep you moving along from bed to bed, that you should be able to snap a quick picture as a memory of those tulips. So Roger, I don't know if you've had any contact with the NCC with respect to the enforcement of that site, which is federal land.
Yes, thank you, Mayor. The only thing I can really add is that there, as the Mayor has stated, there is some temporary no stopping signs that are in place in the area, and I would just suggest that people try to avoid those areas. I mean, they're there for a purpose, and it's to allow for mobility and for safety reasons, to allow access for emergency vehicles and such. So I would ask that they avoid those areas, and should add that this isn't a new regulation. These are temporary no stopping areas that are put in place each and every year in the past.
If I could also just mention one other point. The Canadian Tulip Festival, which is the organizer of the Tulip Festival, has done a great job. If you go to their website, they will have a regular update on a visual update of the tulip beds and some programming. So go to Canadian Tulip Festival. I'm not sure what their site is, but if you look it up, it's probably the best source that you can actually, particularly those people who are not able to get out, you can actually go and see them. I don't know if it's live or taped on YouTube or through social media, but check out the Canadian Tulip Festival website, because they do have some programming that I think is going to be quite innovative, particularly this year, because of course it's the 75th anniversary of the liberation of the Netherlands, mostly by Canadian troops.
Thanks so much. And my second question is on a different topic. It's for Dr. Etches. I'm wondering, it's something that we've heard raised from a number of readers. When it comes to people outside in groups five or smaller, is it like, would it be safe for non-household members to meet outside in like a small group of 2 or 3 or 4, whether that's for Mother's Day this weekend or like as an exercise date type of thing? It's just something that we hear a lot. I know it's maybe one of those loopholes, but just thought we would ask.
My advice is the same as it has been for many weeks now, which is the more you can keep your activities to your household, the better, because it just limits your risk of encountering the infection. So there's no law that says you have to, only see members of your household. It's good advice. It's good advice because there's infection out there in our community, and it's it's possible people have asymptomatic infections, and every time you gather with somebody else, you're not just gathering with that person, you're gathering with potentially all the other people they were gathering with before. You start chains of transmission, right? So if you keep to your household, that chain of transmission is broken. If you start to link up with others, then you can risk more transmission. So the law is provincial, and that is about not gathering in groups greater than 5. So I understand, people need needs social connection. There's no question. And I know people are being creative about how to gather and still stay 2 meters apart, right? So that 2 meters is a distance that's protective. So if you can figure out how to meet up with someone and keep that distance, and that's safe, that's a good way to go. So I hope that helps clarify.
Yeah, that's great. Thank you.
Thank you very much. Moving on, we will go to Susan Sharing on the city from the burbs.
Can you hear me?
Yes, we can hear you now.
Sorry about that. I'm wondering, how difficult is it for you, Dr. Etches, to weigh people's desire to have social connection to what you actually know to be the safest thing to do? Like, would it be better for you just to say, only have contact with your family members? I'm kind of fascinated by this because I mean, obviously we're still seeing a spread, and I'm just wondering how you wrestle with finding the right balance.
Sure. Let me try again to explain in a different way. Why I think it's very good advice still to continue to limit your contacts to the members of your household as much as possible. It's because we're in a time of relaxing some restrictions, but it's on a backdrop of infection in our community that has not disappeared. And so as we go out and we do more activities that bring us into closer contact with others, that risk of transmission in our community is going to go up. And so we want to do all we can to counteract that rise in infection, which if we don't keep trying to push the infection down by staying apart from others, it can rise quickly. It can cause the kind of situation we saw in New York City. That is not out of the question. That is something that all the hard work of people in Ottawa has prevented, and we want to keep it that way. So I think of it sometimes like a balance. If we're easing up over here, what are we doing to keep pushing down on the other side by adding in protections like using masks if we're coming into close contact with others, like continuing to limit our actions to those that are more essential.
I appreciate that, and perhaps I didn't phrase my question properly, but if you ruled the world, would you, without any repercussions or backlash, would you be telling people, giving us a much stronger message? There's some people, I'm over 60, I self-isolate, I don't like it. Would you be stricter with the world or the city of Ottawa if you didn't fear some repercussions about people needing social contact?
I'm very privileged to be in the role that I am in as medical officer of health for the city, and it means I need to look at the health of the whole population overall, every aspect of it. So not just infection, but mental health. We know that employment and loss of employment is very negative for health. So I'm looking at the whole picture, and I know people need to balance different needs. Certainly, it is not good for the community if we start to see the infection rising again, because that also affects our economy.
And our mental health.
And yes, our mental health and our economy. So we know if we let up too much too quickly, and we get a rising rate of infection, that's worse for everybody again. And so I do appreciate the message from our mayor, from our premier, that we're going to go about this slowly. And part of going about it safely is that every individual continues to do their part, like they have been, to protect others and protect ourselves.
Thank you very much. Moving on, nous allons à Julien Paquette, Le Droit.
Oui, bonjour, Dr. Etches. C'est une question un peu simple. Je voulais avoir peut-être un meilleur aperçu du processus pour l'approvisionnement en matériel de protection. Par exemple, est-ce que c'est un système qui est centralisé pour l'ensemble de la ville ou de la région Champlain, ou si, par exemple, les réseaux hospitaliers fait ces choses et les établissements privés de soins de longue durée également de leur côté se débrouillent pour obtenir leur matériel?
Je pense que Monsieur Hendricks est en ligne. S'il a entendu cette question, Monsieur Hendricks, est-ce que c'est possible pour vous de répondre?
I don't think Mr.
Oh,
Hendricks
he's
is
not.
online.
He's not online. OK, je m'excuse. C'est concernant les matériaux, mais je m'excuse, je n'ai pas compris.
Je me demande, la question en fait, c'est comment fonctionne l'approvisionnement en matériel de protection? Est-ce que c'est un
OK.
système qui est centralisé ou c'est un autre, chacun un peu pour soi selon les établissements puis les institutions?
OK, merci. Je comprends. Euh, les provisions comme les masques et les gants sont la responsabilité de chaque organisme, chaque hôpital, chaque foyer. Mais si c'est difficile d'avoir assez, on a un système régional où premièrement, dans la région de Champlain, on partage l'équipement et on fournit les besoins des organismes. Et peut-être quelquefois, c'est une situation où les masques sont bougés entre différentes organisations. Mais c'est une situation où les hôpitaux a un système de mesurer les quantités et quand les quantités n'est pas suffisantes, on demande aux les grandes régions de l'Est de l'Ontario d'avoir plus. Et cette quantité pour l'Est d'Ontario, c'est aussi en liaison avec toute la province de l'Ontario. Alors, c'est un système de soutien pour utiliser les matériaux que la province a s'il y a besoin, mais on commence avec l'organisation premièrement. Est-ce que c'est clair?
Oui, tout à fait. Donc, ma deuxième question, ce serait concernant vous avez parlé un peu plus tôt de l'aide qui est offerte par le réseau hospitalier de la région aux établissements qui ont besoin d'aide, en fait, pour la main-d'œuvre. Jusqu'à combien de temps ça peut fonctionner comme ça, dans la mesure où les employés des hôpitaux qui vont aider des foyers de soins de longue durée, ben, ils ont un rôle à jouer à l'hôpital également. Donc, est-ce que ça peut continuer comme ça jusqu'à la fin de l'été ou il y a un moment où il va falloir essayer de trouver d'autres solutions finalement?
Merci. Je comprends que la question, c'est concernant le soutien des hôpitaux aux foyers de soins de longue durée et pour combien de temps ça peut durer. C'est important, c'était quelques semaines ou plus dans certaines situations où les hôpitaux sont aidés, les foyers, mais c'est pas une situation qui peut durer pour beaucoup de mois, j'imagine, parce que les hôpitaux sont leur travail à faire. Alors, c'est important et c'est l'approche maintenant d'aider les foyers de trouver leur solution, leur source des employés. C'est vraiment une priorité parce que nous avons besoin de recommencer avec les chirurgies et d'autres choses dans les hôpitaux. Mais je dis, c'est important de trouver une autre solution, mais c'est aussi le cas que le soutien reste jusqu'à il y a une autre solution. C'est pas qu'il y a une date exactement quand le soutien arrête ou va arrêter. C'est important de continuer avec le soutien qui vient aux hôpitaux pour les foyers quand il y a besoin.
Merci beaucoup. So moving on, we will go to Josh Pringle at CTV.
Thank you very much. My first question is for Dr. Etches. We get a lot of comments from people who say most of the cases of COVID-19, most of the deaths are in long-term care homes. Why can't we ease more of these restrictions? Can you just explain why these restrictions need to be in place much longer? Because it's been almost 2 months now and people are getting a little restless.
Yes. First of all, I think that we're very fortunate to live in a country, in a province, in a city that is a compassionate place to live, where everyone's life matters, regardless of your age. And I think unfortunately the losses we've seen have been among older adults in disproportionately in long-term care homes. And that is a loss to families, to friends. It's hard on everyone. The reason we can't just say that's happening over there, that's a long-term care home situation and the rest of the population is fine, is because we're connected. The infection doesn't stop at a long-term care home. When workers and supports and services come in and out of the home, and we're all connected. So we saw at the very beginning of the outbreak, when we first started to see a little rise, just the beginning of cases in Ottawa, 2 weeks later, just one incubation period later, we saw a case in a long-term care home because people in the community work in long-term care homes. We're not separate populations. And so as a community, we're affected also in what happens, and we need to therefore collectively keep the rate of infection in the community low, and that does mean all of us have to take action.
Thank you. My second question might be for bylaw, but maybe the mayor. The city of Pembroke announced today that they will ban personal fireworks for the Victoria Day long weekend. Just wondering if the city of Ottawa has given any thought to whether or not people can have fireworks for the long weekend.
I haven't heard of that initiative in Ottawa. Roger, do you have a comment on that? Has that been discussed? I know the burn ban is obviously off now because we didn't want to spread fire department resources to dealing with brush fires and so on. But is there any talk of that, Roger, from the city of Ottawa's perspective that you're aware of?
Yes, thank you, Mayor. The fire chief has said that that he has no intentions of, at this point, of banning fireworks through the long weekend.
Thank you very much. So next will be Kate Porter at CBC Ottawa.
Hi there. I'm not sure, this might be a question for Donna Gray, but I wondered about the money being handed out from the fund. And I see, Shepherd's several $100,000. What is it exactly? Like, what are some examples of what that would be used for? But also, when you mentioned 14 million, I mean, that's a big gap between what they needed and what they can get. And could you explain a bit about that unmet need and what the ideal would have been like?
Sure, thank you, Kate. So the money that went out, you can see in the prioritization that a big focus of the money is still on people living in congregate living situations, both in our shelters and in our residential facilities, and those organizations that are supporting that. Because where we are right now, in many of these areas with their most vulnerable populations, is still in containment and prevention of the virus. And so you'll see those areas and those focuses and the most significant investments in those areas. And things that is funded for are additional cleaning supplies, additional staffing. Many of these homes are suffering, or shelters are also suffering with people getting ill. So they have significant staffing requirements, additional food. So it really is supports around the basic functioning of these organizations. And for them as well, they have a significant need for PPE, just because of the nature of some of the services that they provide and the individuals that are living in those homes. Although, and I think, you know, part of what we want to continue to support and reinforce is, you know, unlike many other cities, we have not had the outbreaks within our shelter system. And many of that is because of all of the infection control processes and the incredible work of Ottawa Inner City Health in supporting that infrastructure to make sure that people are using best practices and really understanding infection control as a preventative measure. And so we want to continue to support and reinforce that both in the shelters and in our residential home setting as well, which is another high risk population. In terms of the areas that we were seeing, you know, is really the gaps or areas that we see still need to be funded. There still is food and a need for increased food. Isolated seniors, we're still seeing a need in isolated seniors, new immigrants, and mental health. And we're seeing that, you know, the more that this situation is more protracted and prolonged, we're seeing increasing needs for mental health and mental health investments.
Okay, thank you. I missed just a little bit because it got spotty at the last little bit there, but isolated seniors, new immigrants, food, I think you said, right?
Food, yes, and
Yeah,
mental health. We're seeing mental health as an increasing need. And just so that to give you a bit of context to that, this installment was the first installment of 3 installments that the provincial and federal government have provided to the city based on, you know, the local needs. We will have another installment coming up in July, and we'll be continuing to just assess and look at where those needs and how those needs are shifting and how we need to support those needs in the community as we move forward.
Perfect. My other question was for Dr. Etches, and you spoke quite a few times to this theme, Dr. Etches, but I was wondering, you know, as we see some stores reopen, schools on the Quebec side going back, are you worried that people are going to let their guard down a bit, or are you hearing that maybe your message might not be as adhered to as people start to see the relaxing of restrictions?
Oh, what I've seen people do so far is take good advice because they're concerned about others and to protect themselves. And I expect that concern for others is still there. That hasn't changed. That's who we are as a community. I've seen lots of demonstration of that. I think people need to resume more activities, and I'm hoping that people understand that's a responsibility, and that as they have the benefit to be able to resume other activities, that they will take that seriously and understand their part, that continuing to maintain physical distancing is something that will allow those activities to continue. Um, you know, I think people understand that we're not out of this, the population's not immune, and so we need to go carefully, and people don't want to go backwards, I'm sure. We don't want to have to say, okay, our hospital capacity is diminished. There's pressure on our ventilators. You know, we're running out of personal protective equipment and masks. Nobody wants that. And so, you know, I think the motivation to continue, again, to stay within our households as much as possible to maintain the physical distancing should be high as people want to resume some other activities.
Thank you.
Thank you very much. Last but not least is Chris Curries at 1310 News.
Good afternoon. Mr. Mayor, you mentioned that park ambassadors will be in place to kind of clarify any confusion. Have the rules so far been confusing to some, or is this just to kind of be safe?
No, I think when we initially announced the park openings, we tried to be very clear, but there were probably a couple dozen tweets that I received wanting some clarification. And just so that, you know, we're in a more educational mode as opposed to an enforcement mode, we found having the ambassadors, for instance, at the LRT stations was very helpful to pass along information and tips and so on. And we hope the same can be transferred over to the park system. So there hasn't been a lot of confusion. I think over the course of the last day or two, there might have been a total of, I think, 10 or 11 warnings, no tickets issued. So if we can get ambassadors out there to just properly educate people that it's not safe to go on the play structures, for instance, but you can go and play over in this section of open space, it'll be beneficial to everyone, ourselves as a city, as well as the people using the parks.
Perfect. And lastly, so we heard from Sport Minister Lisa MacLeod that the province is going to allow some sports teams to reopen training facilities. Now, for the Senators, they're still waiting on the league to set out some guidelines, but it clearly shows that these leagues are, you know, looking to restart. We've also heard some cities have reached out to the NHL to discuss being a hub city. Is that something that Ottawa has done or is planning to do?
Well, I know that there were some people from the Senators, I think, that were trying to set up a phone call with me sometime this week, that it didn't work out. I believe they're going to be calling back next week. I don't know what the nature of that call is. And we don't have a lot of details on the minister's announcement, except that it's for training facilities. So the public obviously wouldn't be involved in going into the arenas or the stadium. So that's really to be determined, because obviously, when you have 25, 30,000 people in a facility, we're going to have to be well past the all clear sign from our health department before that kind of a massive gathering takes place. I, like a lot of people, really want to see the return of obviously the Red Blacks and the Senators and so on, but it has to be done in a organized and thoughtful and health conscious decision-making mode before we even contemplate that. So, you know, all of those sports teams really are in limbo until we get clarification from the province as to whether that would be allowed or not.
Thank you.
Thank you very much, everyone. This is all the time that we have. C'est tout le temps que nous disposons aujourd'hui. Merci beaucoup. Have a great weekend and happy Mother's Day.
Merci. Bon week-end.